Seniors over 70 generally need only 2 to 3 showers per week for proper hygiene, and understanding why this frequency is recommended requires a deeper look at how the body changes with age, how lifestyle factors influence hygiene needs, and how health and safety play a role. As people grow older, their skin undergoes significant transformations. It becomes thinner, more fragile, and less oily, which means it doesn't require as frequent washing as younger skin does. In fact, showering too often can strip away the natural oils, leaving the skin dry, itchy, and prone to cracks. These cracks may seem minor but can easily become entry points for infections, something seniors are especially vulnerable to because of weakened immune systems. By limiting showers to 2 or 3 times a week, older adults strike a healthy balance between cleanliness and skin protection, avoiding the unnecessary harm that excessive washing may cause. Another key reason for fewer showers is that many seniors are less physically active compared to younger adults. Since activity levels decrease, sweat and oil production also decline. A person who spends most of their day at home, reading, resting, or doing light chores does not accumulate the same level of dirt, bacteria, and sweat as someone working outdoors or exercising heavily. Because of this, the body simply does not need the same frequency of cleansing. For most seniors, regular washing of hands, face, underarms, and the genital area every day combined with 2 or 3 full showers per week is enough to stay fresh and healthy. This approach prevents unnecessary exposure to water and harsh soaps, which can worsen dryness and irritation. Maintaining comfort is also a major factor. Many seniors find bathing to be physically challenging due to balance problems, arthritis, limited mobility, or other chronic conditions. Standing in a shower or getting into a bathtub poses a real risk of slips and falls. For some, daily bathing becomes more stressful than refreshing. By reducing the number of showers, seniors can make the process less exhausting while still maintaining a clean and presentable body. Instead of forcing a daily shower routine, focusing on 2 or 3 well-prepared, safe, and comfortable showers per week makes more sense. This reduces the risk of accidents while also ensuring that seniors are not overwhelmed by the task. Another important aspect is the role of personal preferences and cultural habits. Some seniors may feel the need to shower daily out of long-standing routine, but when advised by doctors or caregivers, many come to understand that it's not strictly necessary. Others might resist frequent bathing because of fear of falling, discomfort with cold temperatures, or difficulty handling the process. Recognizing that 2 or 3 showers a week are sufficient helps caregivers and families reassure seniors that they are not neglecting hygiene by showering less often. It helps create a more realistic and sustainable self-care routine that preserves dignity while considering the limitations of age. Scientific research and geriatric care guidelines support this reduced frequency. Dermatologists often recommend limiting showers, especially in older age, and suggest using lukewarm water and gentle, fragrance-free soaps when bathing. Hot water and harsh cleansers strip away protective oils, making dryness worse. A senior who showers only 2 or 3 times a week avoids these risks while still removing dirt, dead skin, and bacteria from the body. Moisturizing immediately after bathing further helps in keeping skin healthy. This combination of less frequent showers and better aftercare leads to improved comfort and fewer dermatological issues, which is critical as medical visits for skin problems can be frequent and costly in older age. It's also worth noting that the concept of hygiene is not limited to full-body showers. For seniors, maintaining a routine of daily oral hygiene, hair care, hand washing, and changing clothes regularly plays a bigger role in overall cleanliness than simply showering often. Clothes in direct contact with skin should be changed daily, and underwear especially should be fresh each day. By pairing these practices with 2 to 3 showers weekly, seniors can achieve the same standard of hygiene as younger individuals who bathe more frequently, without exposing themselves to unnecessary risks. In nursing homes and assisted living facilities, staff often follow this same approach, providing residents with full showers only a few times a week while ensuring daily sponge baths or spot cleaning for sensitive areas. This method has been found to not only improve skin condition but also reduce stress for residents who may be uncomfortable with the bathing process. For seniors living independently, adopting this schedule can bring similar benefits, especially when combined with supportive bathroom modifications like grab bars, handheld shower heads, and shower chairs that make the process safer and easier. Caregivers and family members should also understand that flexibility is important. Some seniors may need more frequent showers depending on climate, health conditions, or personal habits. For example, someone living in a hot and humid region may sweat more and need extra cleansing, while another in a cooler climate may find that 1 or 2 showers a week is more than enough. The key is listening to the body, watching for signs like odor, discomfort, or skin irritation, and adjusting accordingly. However, the general guideline of 2 to 3 showers per week works well as a baseline for most people over 70, particularly those with sensitive skin and reduced activity levels. Overall, showering less often after 70 is not about neglecting hygiene but about adapting to the natural changes of aging. It's about protecting the skin, preventing falls, reducing unnecessary stress, and making personal care routines more manageable and sustainable. Seniors can feel confident that showering 2 or 3 times per week, paired with daily spot cleaning, clean clothes, and good grooming habits, keeps them both healthy and comfortable. This approach aligns with medical advice, respects personal limitations, and ensures that hygiene supports rather than hinders well-being in the later years of life. Overshowering can dry and irritate aging skin, leading to discomfort, and this is one of the most important considerations when discussing hygiene routines for seniors over 70. The skin, which is the largest organ of the body, goes through major transformations as we age. It becomes thinner, less elastic, and produces fewer natural oils compared to younger years. These oils act as a protective barrier, locking in moisture and preventing dryness, but when showers are taken too often, especially with hot water and harsh soaps, these oils are stripped away. For seniors, the loss of this natural barrier can cause intense dryness, flaking, itching, and even painful cracks. Unlike younger individuals who can quickly recover from such dryness, older skin heals slowly, which makes the damage from frequent washing much more significant. This dryness is not just a matter of discomfort, it can also create real medical problems. Cracked skin can serve as an entry point for bacteria, leading to infections. Seniors often have weaker immune responses, so even minor skin infections can become serious health concerns. Over time, repeated irritation caused by overshowering can make the skin more sensitive to rashes, redness, and conditions like eczema. Some seniors may scratch irritated skin in their sleep, which further increases the risk of wounds and infections. By showering too frequently, they may unintentionally worsen their skin health rather than improve it. Another factor is that many seniors already face challenges like circulation issues, diabetes, or medications that thin the skin and make it more vulnerable. In these cases, the skin barrier is already compromised, so adding the stress of daily or overly frequent showers can push the skin past its limits. Dry and irritated skin is not only uncomfortable but can also impact sleep, mood, and overall quality of life. An itch that persists throughout the night can leave a senior restless and fatigued the next day, setting off a chain reaction of health issues including weakness, falls, or increased irritability. Therefore, reducing shower frequency helps preserve what little natural oil and moisture the skin has left, preventing this cycle of discomfort. It is also important to recognize that water temperature plays a role. Seniors who enjoy long, hot showers often feel relaxed in the moment, but the heat accelerates the stripping away of oils. Combined with frequent washing, this results in dry, tight skin immediately afterward. Dermatologists typically recommend lukewarm water for older adults to minimize the impact on skin health. Yet even with cooler water, showering too often still exposes the skin to water and soap, which over time is enough to cause irritation. 2 to 3 showers per week with mild, fragrance-free cleansers are usually sufficient for seniors. Anything beyond that risks drying out the skin unnecessarily, unless a particular health condition requires it. The soaps and body washes themselves add another layer of concern. Many commercial products are designed with younger, oilier skin in mind and contain detergents, fragrances, and alcohol that are far too harsh for seniors. Using such products daily strips away moisture and irritates the already delicate skin surface. Seniors who shower frequently often make the mistake of using these harsher products, believing they are achieving better cleanliness, but in reality, they are damaging their protective skin barrier. Gentle cleansers and moisturizing soaps are recommended, but even with these, less frequent use is generally better for aging skin. Discomfort from over-showering extends beyond dryness. When skin becomes irritated, seniors may experience burning sensations, sensitivity to clothing, or pain when moving. The skin may also become more reactive to the environment, such as developing rashes from mild heat, cold, or contact with fabrics that were previously comfortable. This hypersensitivity can make daily living unpleasant and discourage seniors from staying active, going outside, or engaging socially, because they feel uncomfortable in their own skin. Over time, this impacts mental well-being as much as physical health. Moisturizing is one of the most effective ways to combat dryness caused by frequent bathing, but even with diligent moisturizing, overshowering is still harmful. Constantly applying creams and lotions after each shower may help to an extent, but it cannot fully replace the body's natural oils and protective barrier. For many seniors, applying lotions may also be physically difficult due to mobility issues, arthritis, or simply not having the energy for a time-consuming routine. This makes preventing dryness in the first place, by showering less often, a much more practical and effective solution. There is also a psychological element tied to discomfort. Seniors who feel itchy, dry, or irritated may associate showering with unpleasant outcomes. What should be a refreshing routine becomes a source of dread. They might avoid bathing altogether because they fear the discomfort it brings afterward, which can lead to neglect of hygiene. Ironically, by trying to stay overly clean through frequent showers, they set themselves on a path toward avoiding showers completely. By keeping showers limited to a comfortable frequency and ensuring they do not cause skin irritation, seniors can maintain a healthier and more sustainable hygiene habit. Family members and caregivers often encourage frequent showers without realizing the impact on aging skin. They may equate more bathing with better hygiene, but seniors' bodies are not the same as younger adults. Caregivers must be educated to recognize the signs of overshowering, such as constant scratching, visible flakiness, redness, or complaints about skin discomfort. By adjusting the routine to fewer showers and focusing more on daily spot cleaning of areas that accumulate sweat and bacteria, such as the underarms, groin, and feet, seniors can remain clean without damaging their skin. This balanced approach ensures dignity while protecting against unnecessary suffering. Climate and environment also play a role. In colder, drier regions, the risk of skin dryness and irritation from frequent showers is much higher, meaning seniors should be particularly cautious. Even in warmer areas, where sweating is more common, it's usually enough to supplement fewer full showers with sponge baths or wiping down with a damp cloth. This way, seniors stay fresh without exposing their entire body to soap and water repeatedly. Ultimately, the goal is not simply cleanliness but comfort, safety, and health, and overshowering interferes with all three. Shower safety measures like grab bars and non-slip mats are essential for seniors over 70 because the bathroom is one of the most dangerous places for falls and injuries. As people age, their balance, muscle strength, and reaction time decline, and even a small slip can lead to serious consequences such as broken hips, fractures, or head injuries. For younger individuals, a slip in the shower may only result in a bruise, but for seniors, it can be life-changing, leading to hospital stays, loss of independence, or long-term disability. This makes the bathroom an area that requires careful attention, and incorporating safety features into shower routines is just as important as maintaining hygiene. Grab bars and non-slip mats are among the simplest and most effective solutions to reduce these risks, and their value cannot be overstated. Bathrooms are often designed with smooth, shiny tiles that become slippery when wet, creating a perfect environment for accidents. Soap, shampoo, and water combine to make the shower floor even more hazardous. Seniors with slower reflexes and weaker muscles are less able to catch themselves if they lose their balance. A non-slip mat placed firmly on the shower floor provides grip and stability, preventing feet from sliding out from under the body. This one simple measure drastically reduces the chances of falls. Unlike younger adults who may adjust quickly if they slip, seniors often do not have the same level of coordination or strength, making slip prevention far more critical. Grab bars serve an equally important role. Installed securely on the walls of the shower or bathtub, they give seniors something strong to hold onto as they move in and out or as they steady themselves while washing. Without them, many seniors instinctively grab towel racks, shower doors, or faucets, none of which are designed to support weight. These objects can break or shift, leading to more severe falls. Grab bars are specifically designed to bear weight and provide a reliable anchor, giving seniors confidence and stability while bathing. The psychological reassurance of knowing there is something sturdy to hold on to also encourages more consistent hygiene practices, as seniors may otherwise avoid showering out of fear. The importance of these safety measures is heightened by the fact that seniors are already at higher risk for bone fractures due to conditions like osteoporosis. A single fall can result in a broken hip, which is one of the most devastating injuries for older adults. Statistics consistently show that hip fractures are linked to long recovery times, reduced mobility, and even increased mortality rates in seniors. Therefore, preventing falls in the bathroom is not just about comfort but also about preserving life and independence. A safe shower environment allows seniors to continue caring for themselves without the constant anxiety of potential injury. Safety measures also include making the shower more accessible through the use of shower chairs or benches. Many seniors tire quickly or feel unsteady while standing for the duration of a shower. Sitting down while bathing not only reduces fatigue but also minimizes the risk of slipping. Paired with grab bars, a shower chair creates a secure environment where seniors can wash themselves at their own pace without the pressure of maintaining balance for long periods. When combined with handheld shower heads, this setup allows for thorough cleaning with minimal movement, further lowering risks. Caregivers and family members should also consider the layout of the bathroom. For example, ensuring that grab bars are placed at the right height and in strategic locations, such as near the shower entrance and along the back wall, can make all the difference. Non-slip mats should cover the shower floor as well as the bathroom floor outside the tub to prevent slipping when stepping out. A wet floor outside the shower is just as dangerous as the shower itself, and many accidents occur at this moment of transition. By extending safety precautions beyond just the inside of the shower, the overall risk of falls can be significantly reduced. Lighting is another subtle but important safety factor. Seniors often have diminished vision, making it harder to see wet spots or obstacles. A well-lit bathroom with bright, even lighting helps reduce missteps. Combined with grab bars and non-slip surfaces, Good lighting creates an environment that supports safety at every stage of the showering process. Small additions like anti-slip strips on the floor, or replacing shiny tiles with textured surfaces, can also complement the role of mats and bars. These adjustments are relatively inexpensive but have a huge impact on safety. The fear of falling is a common issue among seniors, and it often leads to reduced bathing frequency. While this may prevent accidents, it also harms hygiene, comfort, and self-confidence. When seniors are equipped with safety features like grab bars and non-slip mats, their confidence improves, and they are more likely to maintain a regular bathing routine. This not only benefits their health but also boosts mental well-being, as feeling clean and refreshed contributes to a sense of dignity and self-worth. Independence is preserved when seniors can shower on their own without needing constant assistance, and safety features are the key to making this possible. Families sometimes underestimate the importance of these modifications because they seem simple. However, what looks like a small change can make the difference between a safe shower and a catastrophic injury. Installing grab bars and placing non-slip mats is far less costly than hospital stays, surgeries, and rehabilitation that often follow a bathroom fall. In this way, these safety measures are not only protective but also financially wise, helping to reduce the burden on both families and healthcare systems. In addition to physical safety, these measures contribute to a positive emotional environment. Seniors who know their bathroom is equipped with the right tools feel less dependent on others. This sense of security can reduce stress and encourage healthier routines overall. It also relieves family members of constant worry, knowing their loved one is safer when showering alone. The psychological benefits of reducing fear and promoting confidence should not be overlooked, as they directly affect quality of life in older age. Daily spot cleaning of the face, hands, underarms, and private areas is one of the most practical and important hygiene practices for seniors over 70, especially when full showers are taken only 2 or 3 times a week. As the body ages, maintaining cleanliness without overburdening the skin or risking falls becomes a delicate balance. Spot cleaning provides a solution that allows seniors to stay fresh, prevent odor, and protect against infections while avoiding the discomfort of daily showers. It is an efficient way to address the areas most prone to sweat, bacteria, and odor, ensuring hygiene is preserved without unnecessary strain. The hands, for example, are constantly exposed to germs from surfaces, food, and daily tasks. Seniors may be more vulnerable to illnesses if bacteria or viruses linger on the skin and make their way into the mouth, nose, or eyes. Washing hands several times a day with mild soap and water is essential, not only for personal hygiene but also for preventing the spread of disease. For older adults with weakened immune systems, this simple act can be life-saving. Unlike full showers, which may be tiring or unsafe to perform daily, hand washing is quick, effective, and low risk, making it a cornerstone of daily hygiene. The face is another area that benefits from daily cleansing. Seniors often have more sensitive and fragile facial skin, but sweat, oil, and environmental dirt still accumulate. Gently washing the face once or twice a day with lukewarm water helps prevent irritation, clogged pores, and the buildup of bacteria that can cause rashes or infections. For seniors who wear glasses, hearing aids, or dentures, cleaning the face regularly also supports comfort and prevents skin breakdown where devices touch the skin. Additionally, washing the eyes, nose, and mouth areas keeps the face refreshed and reduces the risk of infections. Underarms require special attention because they are warm, moist areas where sweat and bacteria combine to create odor. Even if seniors are not very physically active, the underarms can still produce perspiration, which, when left unwashed, leads to unpleasant smells and discomfort. Daily cleaning of the underarms with a washcloth and mild soap or even just a damp towel helps maintain freshness. This practice is especially important because odor can affect confidence and social interactions. Seniors who feel self-conscious about body odor may withdraw from family gatherings or social activities, impacting their emotional well-being. Spot cleaning the underarms daily allows them to feel comfortable and confident without the need for frequent full showers. The genital area and private parts are arguably the most critical areas for daily cleaning. Aging often brings with it issues like incontinence, weaker bladder control, or increased susceptibility to urinary tract infections. Moisture and bacteria in this area can quickly lead to irritation, infection, and strong odors if hygiene is neglected. Cleaning the genital area once or twice a day, or whenever accidents occur, is essential for comfort and health. Using a soft cloth with warm water or fragrance-free wipes can keep this sensitive area clean without the harsh effects of daily full-body showers. For seniors who struggle with mobility, caregivers can assist with gentle, respectful cleaning to ensure dignity and hygiene are both preserved. Feet are another area often overlooked in daily routines but are equally important. Seniors may have reduced circulation in their feet, making them more prone to fungal infections, sores, and ulcers. Sweat and moisture can build up between the toes, leading to irritation or infections if not cleaned regularly. A simple daily wipe with a damp cloth, followed by drying thoroughly, can prevent these problems. Foot hygiene also ties into comfort, as clean and dry feet make walking or wearing shoes much easier, reducing the risk of blisters or odor. Spot cleaning not only maintains physical hygiene but also helps seniors feel refreshed and energized each day. Many older adults may not want or be able to shower frequently, but wiping down the key areas makes a noticeable difference in how clean and comfortable they feel. For those living alone, this routine preserves independence because it requires less effort and risk compared to a full shower. It can be done at the sink, in a chair, or even in bed if mobility is limited, making it an adaptable practice for all levels of ability. There are also mental health benefits tied to daily spot cleaning. Feeling clean and fresh directly influences self-esteem and mood. Seniors who are clean and odor-free are more likely to interact with family, friends, and caregivers without embarrassment. Social connections play a huge role in emotional well-being, and hygiene is a big part of that. By maintaining these small daily routines, seniors protect their dignity and avoid the isolation that can sometimes come with concerns about body odor or uncleanliness. From a caregiver's perspective, encouraging spot cleaning is an effective way to support hygiene without creating overwhelming tasks. Bathing can often be one of the most stressful points of interaction between seniors and caregivers because of safety risks, physical effort, and resistance from the senior. Spot cleaning, however, is less invasive and quicker, making it more acceptable and manageable. It reduces the tension around hygiene while still ensuring that health is not compromised. Caregivers can integrate it into daily routines seamlessly, such as wiping underarms and private areas during dressing or cleaning the face and hands after meals. The products used in spot cleaning also matter. Harsh soaps, alcohol-based wipes, or fragranced products can irritate aging skin, so gentle, unscented options are best. Warm water and a soft cloth are often enough, especially when combined with mild cleansers designed for sensitive skin. Moisturizers can be applied afterward to protect against dryness. In cases of incontinence, barrier creams can be used to protect the skin from constant moisture and prevent rashes or breakdown. This routine supports both cleanliness and skin integrity, which are essential for overall health in older adults. Spot cleaning also adapts well to changing seasons and climates. In warmer weather, seniors may sweat more and require more frequent cleaning of the underarms and private areas, while in colder months, they may only need once-a-day routines to stay comfortable. This flexibility makes it an ideal practice that can be adjusted to individual needs without being overwhelming. The simplicity of wiping down with a cloth or using pre-moistened wipes ensures that the routine remains practical no matter the circumstances. Ultimately, daily spot cleaning provides a balance between the need for hygiene and the limitations of aging. It reduces reliance on full showers, prevents odors and infections, protects sensitive skin, and supports dignity and confidence. By focusing on the key areas most prone to bacteria and odor, the hands, face, underarms, private areas, and feet, seniors can remain clean and comfortable while avoiding the risks and discomfort of overshowering. This routine is not just a substitute for bathing but a vital complement that ensures hygiene remains consistent and effective throughout older age.